tests, if that's alright, just to make sure that there is no trauma to the brain or any lasting damage. Your usual doctor, Dr. Roberts, he is on annual leave at the moment to spend time with his family. It's been a difficult time for everyone working very hard to ensure people are okay, and he needed to take a little time to make sure that he is okay and his loved ones too. So you are left with me. My name is Chernyshevsky, but you can call me Alex. Yes, I'm Russian. Well, in Russian we say Меня зовут, which means my name. Меня зовут Alexei. Lexi. Alex, пожалуйста. No. I'm from the fair. It's an oblast, so it's a big place. I'm from the city. It's about 100 miles from Moscow. I came here to be GP originally. In Russia, we don't really have GPs. We have specialist doctors. So if you have head problem, you go to the head doctor. If you have throat problem, you go to a throat doctor. Tummy troubles, gastro doctor, etc. It's a different system. I quite like the GP system here for vetting and ensuring that we know what is wrong with the patient before sending them to a specialist, because sometimes the patient might not know exactly what is wrong with them. But it's enough about me. I need to know a little bit more about you, and we'll get on with the test. Alright? Alex, please. No need for doctor. Alright. If it's alright. So, tak. This is your great name. Can you tell me what date it is today? How old are you? So you were born in the year. Mathematics test. For me, not for you. Do you have any brothers or sisters? Alright. What's your home address? The postcode. And who is the Prime Minister of the United Kingdom? What countries make up the United Kingdom? England, Scotland, Wales, Northern Ireland. No. Who's the Mayor of London? And finally, you ready? This different one. What color are flamingos? Pink. That'll do. I think they change color, but it's close enough. So we just ask you these questions just to make sure that you are compos mentis, that you are aware of who you are, where you are, and what's happening. It's simply to orientate yourself here, just in case the bump on the head might have knocked a memory out or something like that. But excuse me. First, before we do the test, I want to do one little thing, if that's okay. Now, let's see here. This, don't worry, it's nothing strange. It's just a toy. Well, it's a little strange. I want you to hold this, please. It's alright. Thank you. And I have one too. So I want to explain to you what we're going to do with this toy. Now, if you look at the toy, see here, it's different colors down here, and if you touch it, has a smell. Yes. And if you flick it, it makes a sound here. Not a great sound, but I want you to do something with this to help me to check everything's working. Alright. Okay. You ready? So first of all, I want you to take it and hold it in your hand like this. See, doctors get boo-boos too. So now close your eyes very gently and concentrate on how it feels in your hand. Forget for a moment how it looks or how you think it looks. Feel all the different textures, the different ways it bends and moves in your hand. And then when you're ready, open up your eyes and take a look at it. And now you recall all the colors. So the main color is blue. When we look here, we have purple, blue, green, yellow, orange, and red. Red is my favorite color, krasny. Now, look at the colors again. Red, orange, green, yellow, blue, purple. Now, I want you to put it in your hand again. Feel it. And close your eyes. Now imagine you are feeling the colors. What does green feel like? Blue, purple, orange. Open your eyes again. Now smell it. You smell nice, distinctive smell. Okay, but don't worry, it's not poisonous or anything. So now you can smell the colors. So close your eyes. There. Now smell. Red, green, purple, blue. Oh, got it right. Now, last thing, when you flick the little colors like that. You can do whatever you want with this. It's very malleable, very changeable, almost squidgy. There. Oh. If you put it to your ear like this, you can hear the colors. Now, if you hear the colors, you don't need to see them. Strange exercise, I know. And don't worry, I'm not crazy. You'll find out. But you keep this, it's a gift from me to you. And what we'll do is use it as a tool sometimes. You can bring it back with you when you're ready. But you can take it home and you can do that same exercise. The most important part is putting it in your hand at the start like that. And just closing your eyes and concentrating on how it feels in your hand. You should do this when there is no television on, or you are not busy, you don't have things to worry about, or you don't have to do work or things like that, okay? It should be just something to do for you, and it doesn't have to be with this, alright? It can be with anything. It could be with, maybe you have like a wooden item, or like a piece of food. So a peanut. Pop the peanut in your hand. Feel it. Touch it. Remember it. All the different senses trying to communicate with this item and to send signal back to brain. Alright. I'm sorry about that. Let's get on with it. Get on with my job before I lose it. Now, I don't think that we noticed any issues with olfactory, which is sense of smell. So we don't do a nose test today. Instead we start with the optic nerve. But there are lots of cranial nerves, you see. They're on the head. They can affect the whole body, but we'll concentrate on the head. So we take a look at optic response, which includes pupillary light reflex, thing like that, and swinging light. Then we go on to oculomotor, which is movement of eye. But first, pupillary response. So we need to put on gloves. Be hygienic. Especially because I hurt my finger. I was hot gluing costume for my cat, and I got some hot glue on my finger, and I thought, oh, tear it off, you know. Foolish me. I pull off a lot of skin, and so I run it under cold cap. We tap, but it hurts a lot, and I feel like an idiot, and my cat thinks I'm an idiot. Anyway, so first of all, pupillary response. So what I want you to do, and as I say, look directly ahead at me for now. Alright? I'm going to turn on this light. It's quite bright, so be warned. Alright? And I'm going to lift it up into your field of vision, right into your eye, and see how the what is word, aperture of your eye adjusts to the light. Alright, you ready? There you go. See, very bright light. It's very easy. Right in. Okay, good. I'll just take a little bit closer. I'm going to rest my hand on your face, if that's alright, just to make sure. Alright. Good, cover the one eye. Just like that. And the other eye. Oh, very good. It's a busy day outside, so you might hear cars going by quite a lot. I apologize for that. I cannot control traffic yet. Does it feel any discomfort? If at any point you feel discomfort of what we're doing, you tell me, let me stop. I can come back later. You're here all week. One of the signs of concussion can be alternating pupillary response. So if you get hit on the head, one pupil can look much larger than the other one. And it's a good sign if you're worried a friend might be concussed or they bumped their head because they drank too much. Then first thing, to make sure that they do not go to sleep, even if they're very tired, they cannot sleep. But to check if they are concussed, call a doctor or ambulance, of course, but you can shine light in eye like this, and it will make the aperture of the eye, the pupil, grow or shrink. Should, for in concussion, it can have different results. Sorry, my English isn't good always. Okay, swinging light. Now this is to just don't move your eyes. Look straight ahead at me, and I will swing light in. How's that? That's a bit strange, but not right. So this is to check. Oh, hello. To check pupillary response to sudden light stimulus. Now. Very good. It's the police to take me away to the little bit. Don't worry. Like all worries, they pass. So noisy now. Maybe they are going to pick me up. Give me a second here. with the hair. You right? Got hair in your eye. Check. No? Any discomfort in there? Alright. It's okay. So, your optic response is good. We need to do the oculomotor test now, which is light reflex again with the extraocular muscles, which is into the dorsal oblique after this one done. So what I need you to do is check a menace response, which is weird. So I'm going to do this. This is your pupils and for your eyelids. No? So I'm going to do that in your face. No. I'm sorry, it's very threatening, but it is the idea of the automatic response. It feels very mean doing it, but you have to surprise someone a little bit, you know. I think you're fine. So we need to check the ventral lateral rotation of your eye. There are two tests we want to do for this. Put that there. The first one is with the light, our old friend, bright light, but this time keeping your head absolutely straight. I want you to follow the light as I move it around in front of your face. Okay? I need to scratch my face. Yeah, that'll do. You ready? So follow the light. Just don't move your head, please. Keep it straight. That's it. Follow the light with your eyes. And move your eye around. And if you feel discomfort, tell me. Sometimes a lot what people feel when they do this exercise is that their eye gets tired. And it's perfectly normal. We're predators. Keep looking. That's it, follow the light. As we are predators, we have our eyes on the front of our heads, and our peripheral vision isn't great. Now pray, hit them on the side, and then move them around a lot more, like a chameleon or whatever. Let's try something else. Got the metronome. Wind it up. So, I'm not hypnotizing you. I want you to keep an eye. So follow the metronome with your eye. Eyes, both of them. Don't move your head. Alright. And how is it? Do you feel any discomfort or pain? No. Your eyes getting tired. You're getting sleepy. If you feel tired, it's absolutely fine. Patients often find these exercises sleep-inducing or relaxing, and they find that afterwards they go to sleep pretty easily. Okay, it's good. Put it there. And again with the follow the light. Just with your eyes, please. not head. Don't move your head around. No, finger. So yes, follow finger. Just with eyes, not with head. There's a bit delay in your movement, but it might be fatigue or because you bumped your head. Alright, I'll go back, forward like this, and back. See my sweaty fingers. Come forward like this, and back into the left, to your right. Alright, good. See how easy this is. They should not call it a cranial nerve exam. It's too easy to be an exam. Oh, alright. Dragon min någon sensual igen. So, we now look at, we try to concentrate on your facial reaction to things. So the motor muscle for mastication, which is not food, it's chewing. Alright? Sounds like something bad's happening. And so what I need you to do is to move your jaw. Now, we as humans, distinct to thyroid and other lymph nodes, we carry stress in the jaw. So often, if we are stressed or tired or overworked or whatever, we feel weight or strain in the jaw. And so it's good exercise not to grind teeth, but to articulate the jaw. Alright, so what I want to do, if it's okay, I need to feel around your jaw area. Alright, I'm just going to hold it in. I'm just going to press very gently on your jaw. And while I'm doing that, I want you to open your jaw for me. Open your mouth. Very good. Does it hurt? Squeeze down like that. No. Okay, close your mouth. Now grit your teeth really hard. Perfect. Open your mouth again. Now move your jaw if you can. If it feels painful, you stop. Alright? We'll wait for Mr. Plot to go by. Good grief. It's a busy day. People shouldn't even be out. Alright, so now move your jaw from side to side if you can. Is it hurt? A little bit. Alright, let me take a quick look. What about this side? Alright. But it doesn't hurt, it's more like an ache. Alright. So what I need to do is I need to just with the end of my, it's a pen as well, but it's not ink, just what I do. This is a very soft tip. It's designed so that it feels quite nice here. See, so it like a little balloon or whatever. is I'm going to poke parts of your face to test not just your level of pain or discomfort, but to check the reactions to the muscles in that area. Alright? Now please, I might not say where I will poke, but what I want you to do is tell me where on your face you feel it. And I'm going to come in very close. I hope that's okay. Alright, thank you. Here we go. Done. A little up, actually. What if when I touch it like that? How does it feel? Alright. It's quite the bone bit there again. Alright. Other side. You ready? Good. The bone bit. Alright. So just look straight ahead very briefly. I put this pen in between. And look at it. Grit your teeth, please. Right. So we need to look at the vestibulocochlear section. And this will look at it's like your head positioning, but also your hearing as well. So what we need to do first, I need to put my hand, I'm going to put my hand on the back of your head and hold it onto the base of the skull, and do the same with the jaw at the front. Okay? So close here. Alright, now I want you to relax and let the weight of your head rest in my hands. Don't worry, you're safe. I got you. Alright. And I'm very lightly going to let go and you regain control of your head. Good. Other side. Alright. So under the chin here and on the back of the head there. And just hold. That's it. Relax and let your head rest in my hands, and then I'm going to slowly let go and you get back control. Alright, here we go. Perfect. What would that do is to check your posture. And by that also, oops, is to quickly, it's alright, to check up and down your eye movements. Down. So please, I'm sorry. Is your eyes daylight again? If you look up for me. Let's take a look. I think I did see a little. Hold on. Just a little here. Look up. Keep looking up. Very good, very good, very good. Look down. Look down. Look to your left. Down. It's possible. switch off. So I need to do little hearing test, and I like to examine your ears. So first we have this, which is to measure it's a tuning fork. It's to measure the response of your ears, to check where you hear it, basically. So I hit it like this and run it over your head like that, down. And what I need you to do is tell me when you stop hearing it. Alright? Done. And again. Done. One more time. So, next thing, each side, I'll cover your eyes with my hand and click my fingers. Wait, tell me when you stop hearing the clicks. Now, to the left hand side first, so I cover your eyes. And here we go. Other side. Really? Okay. Let me have a little look in your ear. Give me a second to listen first. Alright. Let's continue a little bit. Got a boop. So put on the ear like this. Alright, now just a little bit of earwax on the outer ear so I could get at it. We'll do a test in a minute again just to see if it improves your hearing, but I'm just going to look in the other ear too. This was the one that had most of the problem, the right hand ear. Alright, let's take a look. Alright, yes. Let's see here. Oh, sorry. Just in time to hear the noisy bike. A little bit more up here. Let's get it. Alright. Get this a little bit more. Okay, good. Perfect. Now I tried just once. I want to do the tuning fork again. All right, ready? Clear. Now, you should be able to hear it longer too. Good. And cover your eyes to left ear first. All right. Here we go. Ready? Is it better? Okay. In the right ear. Cover your eyes and all right in. Конечно. Отлично. So we need to check the glossopharyngeal vagus and accessory nerves. Your vestibulocochlear is fine, and there. Cleaned up your ears a little bit too, which is always good. Always helps. But what I want you to do now. Now I want you to the classic doctor say not like I did, not a growl like I did, would say it with your mouth open. Open mouth. Let me have a little look in your mouth. Keep it open, please. All right. Now I think you should book. Your teeth are fine, but there's some food that is saturated, caught in the teeth, and it could cause you problems. So maybe go to the dentist or book appointment to make sure there's no problems. But I'm looking at the glandular swelling, inflammation at the back of the throat, which I don't see any of. But what I do need to do, swallow for me, please. So just, that's it, lift your chin up a little bit like that. Now, I'm going to feel your larynx. Swallow again. Like that, down. Alright. Does it hurt when you swallow? Your throat is a little dry, but so it will not always feel nice, but in general, it does. It hurt. We like to check for dysphagia, which is swallowing condition. It's linked to speech and language therapeutics. And so, if you have problems swallowing, it can lead to problem. Speaking, it's all to do with how the accessory, the articulation of the throat. So, everything in combination with everything else working successfully as a unit, like people. Yeah. So lift up your chin just a little bit again. And swallow for me again. And I'll massage your larynx. Alright. Now I'm going to check your lymph nodes up here. Swallow for me again, please. Alright. Okay. What I want you to do very quickly for me, and this is difficult for me because English is not my native tongue, and we say letters a little bit different in Russian, but we've got to check hypoglossal nerve, which is your tongue. So first of all, just have another look inside your mouth, please. Apologies. Open wide, please. Now lift. Lift your tongue up. Side look at me. Alright. Put it back down. Now, what I want close your mouth. Just try to keep. That's fine. Don't worry. I want you to repeat the alphabet after me. Okay. And listen closely to how I am pronouncing the sounds, and try to replicate that with your tongue movement. And swallow in between each letter. I'll do it with you. All right. A. B. C. D. E. F. G. H. Right. I. J. K. L. M. N. O. Keeps flying. P. Q. R. S. T. U. V. W. X. Y. And Z. Or C. That way it rhymes. Alright. Just very, very quickly count down from 10 with me 3 times. Alright. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. One more time. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. Have a big swallow. No. No pain. So in hypoglossal, we look for tongue symmetry in size. I have big tongue. And what we also have to look at is how the tongue moves to produce letters, to see how it sits in your mouth. So for example, I have overbite. And the overbite is because my tongue is so fat. It sits on my bottom teeth and pushes my front teeth out. So braces won't help because my tongue is so fat. It will always push them forward. But we have to look at the tongue in different resting positions. Your tongue naturally rests back a little bit. And so sometimes, if you swallow, you might have a problem. Because naturally your tongue goes back. You might find you choke up water quite a lot. Or you aspirate. Aspirating is when the water goes down the wrong tube. So it doesn't go down where it's meant to go. It goes into your lungs. That can be mitigated with tongue exercises. And it is simply repeating alphabet and learning how to pronounce letters effectively and in the best way for the shape of your mouth. I could contact speech and language therapists to help you with this. I don't think it is anything serious at all. It's certainly nothing to worry about, and it's not life-threatening. But if you experience difficulty swallowing, then I would recommend that perhaps it is something you consider in the future. Alright, final part, test, exam. So I need to just palpate all over your face. So tap, 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 tap. And when I'm doing it, I'm going to be counting down from 10 again until I'm done. Then we're finished, I promise. No more me, no more Alex. Alright, so I'll start here and work my way up. Alright. 10, 9, 0, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. How are you feeling? Your headache's gone. That's good. I'm a better doctor than I thought. Well, no one can beat Dr. Roberts. I'm sure that you understand his absence right now. It sounds like they started doing drugs. So that's time for you to get some rest. Now, don't forget Alex, please. Everything is fine. What I want you to remember, more importantly than ever, now more than ever, is to not just heal, but to be kind to yourself. Don't be cruel to yourself or other people. Be kind. You hurt yourself. You're feeling hurt. You need to take time for you to heal. And don't be ashamed or afraid to take any amount of time that you need in order to heal. Because you and everybody else, they deserve you at your best. Well, I hope that it hasn't been too embarrassing meeting me. Yet I hope that when I next see you, you're feeling a lot better. But until then, your notes, your charts are all updated. You can relax, and one of the nurses will be around soon to take your orders for dinner. Alright? Take care, rest well, and get better. Care for yourself. Doctor's orders. До свидания.